So are we helping or are we hurting? It was a question posed this morning on the Senate floor with regard to Idaho's Safer Syringe program. This is the program where drug users can exchange an old used needle for a new clean one. The point is to reduce the risk of spreading diseases like HIV or hepatitis through dirty shared needles. The residual effect of the program like this, though, is also to reduce drug overdose deaths and possible access to drug abuse treatment. This has been a thing in Idaho since the summer of 2019, when Idaho lawmakers decided it would be a good thing to have. Well, today they decided it wouldn't be a good thing anymore, with the Senate following the House lead to end the syringe and needle exchange program. Some lawmakers worry this is a case of throwing out the baby with the bathwater.
Idaho lawmakers drew a hard line Wednesday. A vote in the Idaho Senate sends House Bill 617 to the governor's desk for approval. The pending law would simply repeal Idaho's Syringe and Needle Exchange Act. Supporters of the repeal say they aren't convinced that the program really helps.
There has been no local analysis of how the Idaho's needle exchange program has reduced needle stick injuries. Over the life of the program, Idaho Department of Health and Welfare reports that more than 1 million needles were collected, but 937,000 were given back out.
To take somebody, for example, addicted to heroin and give them free needles in a clean place to shoot up because we don't want to spread disease, I think is the wrong message to say, because you're basically saying we're going to allow you to do what you want with no judgment and not actively seek care for you. I don't see that as an active way of seeking care.
Critics of the repeal, who support the exchange programs, say there's good data that supports what is an imperfect solution.
According to a Boise State study that was recently done, people that access syringe programs are 5 times more likely to access treatment. Substance abuse disorder is a disease. It's chronic, it's progressive, and it needs treatment like any other disease. A harm reduction program is a place where it provides services for folks to come and try to exchange a needle or get other services.
In short, needle exchange programs provide an option for addicts to get a clean needle to avoid HIV, AIDS, and other bloodborne disease. The programs are also a center point for people looking for help beyond that. Critics of the program say help is great, but this is not the way in their view.
I'm a believer that we do need to help these people, but the way that this money was being used is not the right way. And so I'm all about completely supporting this bill. And if we want to come back and figure out another way to help these people, then great.
Back in February, police investigators in Caldwell and Boise searched offices of Idaho Harm Reduction, one of the syringe exchange program hosts in our area. Investigators were searching for items outside the scope of needle exchange, and they found drug paraphernalia. Idaho Harm Reduction has since indicated on their website that they've shut down. It was argued on the House floor and the Senate floor that bad actors were taking advantage of the program.
But to repeal the entire section of code because maybe there was a bad actor, there are many good actors, and those are the places where people's lives are in jeopardy.
AA doesn't hold their meetings in bars. They don't have an occasional drink while they're having the meetings, because that's the enabler, and that's what keeps them in that cycle. So I would urge for you to vote yay in support of this bill.
So the Department of Health and Welfare is in charge, as it stands right now, of the needle and syringe exchange program. And I reached out to them about the idea that this sends the bill to the governor's desk and he could basically sign away the program, but also questions from lawmakers about the reliability of the data that is on the Department of Health and Welfare's website. And I got a response a short time ago from Health and Welfare. They told me that the legislature sets public policy and the Department of Health and Welfare will implement the public policy. They do not have a position on the legislation. Again, Brian, the governor would need to sign this or it would go into law without his signature, but if it does get signed, it would go into effect July 1st.
I'm kind of confused about what Bjerke said on the floor about not having accurate data or local data. On their own website, Department of Health and Welfare, they said they gave out 633,000 sterile syringes, an estimated 116 hepatitis C and 35 HIV infections were averted, saving $22 million in associated lifetime health care costs. That is all right there for them to see. I guess my question to you is, how much of this has to do with the raid on the Idaho Harm Reduction project?
Yeah, so in Caldwell and Boise, which we mentioned in the story, we actually heard, for example, Senator Tammy Nichols stood up in debate and said, we've heard concerns, we've heard about problems that are going on in these centers. We should probably look into what's happening there. Again, no charges or no arrests were made, by the way, in related to those two searches.
And I don't think any of the needles were touched in this raid.
No, they were looking for things that wasn't needles. They were looking for other drug paraphernalia.
All right, thanks, Joe.